Hi, I'm Dr. Josephine Carlisle, a clinical psychologist here at Alliance Counselling, and I'm here to talk to you about emotion regulation in teens. When I say emotion regulation, what I mean is the process of accepting and managing difficult emotions and thoughts so that even in their presence we could continue to act in ways that move us towards our goals and in ways that are in line with our values. Teens and adults alike may experience problems with emotional dysregulation, but teens in particular are vulnerable, and that's because they're undergoing enormous changes in the architecture of the brain. They're reaching sexual maturity, striving to develop a sense of identity and independence, they're dealing with peer conflicts, all whilst being under increasing pressure at school. Experiencing emotions, intense emotions, and emotional dysregulation is part of being a teen. However, in the absence of appropriate coping skills, problems can develop. They might develop habitual patterns of responding in an attempt to soothe themselves, which end up being self-defeating. So for an example, they may engage in self-harming behaviours or substance use, or it might be more subtle, covert, internalizing behaviours such as avoidance and suppression. If these become habitual ways of responding, this is likely to lead to further emotional difficulties and reduce the amount of goal-directed behaviour. So, for example, if a teen finds their emotions so intolerable, they are trying to escape them by avoiding things, and that costs them the things that they care about, like meeting up with friends or even attending school. It's important for teens to learn to identify, label, accept and manage the intense emotions that do come along with adolescence. And this starts with the adults around them modelling healthy ways of responding to their own and others' emotions. Adults can promote self-regulation in teens by showing them that emotions are a normal and necessary part of a full and rich life, and they can be tolerated and accepted. I'm sure we've all been told and heard ourselves saying things to our children like, don't be scared, stop crying, don't worry. But these in themselves are completely understandable responses because we want to protect them from pain and we want to protect ourselves from emotional pain. But this may send a subtle but powerful message that emotions are intolerable, they're not the correct response to the situation, and they need to be avoided. Children and teens need to have their emotional experiences validated, and that means letting them know that their emotional experiences, they're understandable, they can be accepted and expressed in an appropriate way. You can actually start improving your own and your family's emotional regulation today by focusing on your health and well-being. Things like good nutrition, good sleep, regular engagement in exercise, pleasurable activities, hobbies, connecting with friends and loved ones, and spending time on small mindful practices such as whilst you're walking, focusing on your surroundings and on your body rather than what's going on inside your mind and making mental to-do lists, for example. The research has suggested that all those small things I just mentioned can be very effective strategies for improving your mental as well as physical well-being. Sometimes teens and families need extra support from professionals. Therapists, psychologists, counsellors like us here at Alliance can support teens and families to have a greater understanding of the origins and triggers and meanings of the behaviours and emotions that they see in their teens, and they can assist them to develop skills and strategies for dealing with the emotions and for dealing with triggers such as relationship difficulties. They learn how to tolerate intense emotions and allow them to pass. For example, therapists here at Alliance will use models such as cognitive behavioural therapy, dialectical behavioural therapy, and acceptance and commitment therapy so that they can become better able to accept and tolerate their emotions and continue to engage in things that are important to them. You might be watching this and thinking it's too late for me or my child, we've gone through that teenage stage, but yes, it is important to teach emotion regulation to, say, 11 to 15-year-olds whilst that development is happening, but research shows us that development continues to 25 and maybe even beyond. So even if you're watching this and you're 65, it's not too late to make positive changes to your emotional health. Thank you.